Here with me is Professor the Lord Darzi. He's been the Director of IGHI's Centre for Health Policy since 2010. Today I'd like to find out more about the current challenges facing health policy today and how the Centre is working towards overcoming these. So why did you establish the Centre for Health Policy?
Well, it really started following my ministerial appointment, which became very clear to me that policy is no different than science. All the science that we practice is evidence-based, and policies is exactly the same. And what's also interesting is that there are very few clinicians and scientists who are actually involved in the art of policy making. So the creation of the centre was in one way capacity building. So we have a master's in health policy, which really underpins the centre. And we have an astonishing group of students, about 50, with different backgrounds, clinicians, civil servants, scientists, who are really understanding the skills of evidence-based policy development.
And what are the challenges facing health policymakers today?
Health is, in many ways, the biggest growth area in any sector. And at the same time, it's facing the biggest set of challenges. The demographics are frightening. We're all getting older. Both the burden and the nature of disease is changing. From a century of managing infectious disease, we're talking about the burden of chronic disease, the challenges of quality of life as you grow older. So in many ways, it's a ripe area for innovation, for creative evidence-based policy making, and also addressing some of the big challenges is how do you disseminate innovation? What's the policies required to accelerate the adoption and diffusion of innovation?
And what does the centre focus on?
We do a wide-ranging research. Evidence-based policy making is one area. In other words, if you look at science, we tend to create the evidence base when there's a new scientific discovery. The next challenge is how do you translate that evidence into clinical practice, and that's where policy comes in. What are the interventions that we can introduce? What are the incentives? And we've been involved in behavioral economics on one end, into research into patient safety and reducing iatrogenic injury or avoidable harm, into e-health and the introduction of new technologies and innovations and in new delivery models for healthcare.
And how does the centre influence policy?
Well, as most centres or most global health institutes, there's quite a big awareness part of it, but at the same time we have some significant number of outputs. As you know, we've hosted the Global Health Policy Summit in 2012. Last year we had the fortune of working under the leadership of Qatar Foundation in leading the WISH conference in Doha last December. And all of these meetings have produced some evidence-based outputs, what I call the policy bundles. What are the 5 things you can do in a certain area, like mental health or end of life, that you can take back wherever country you're coming from, developing, developed, or emerging economies, and really driving that policy implementation.
Thank you for taking the time to be interviewed today.
Thank you.